Now let's discuss epidemiology. And for HPV, 2 billion are affected, 248 million saw the carriers, and 12.3% in the Western Pacific and African region are affected. Now let's discuss the transmissions of hepatitis. Hepatitis B virus can survive outside the body for at least 7 days. During this time, the virus can still cause infection if it enters the body who is not protected by vaccine. The incubation period is 75 days but can vary from 30 to 180 days. The virus may be detected within 30 to 60 days. In addition, in highly endemic areas, hepatitis B is most commonly spread from mother to child at birth or through horizontal transmission. Hepatitis B is also spread by percutaneous or mucosal exposure to infected blood and various body fluids. Sexual transmission may occur, particularly in unvaccinated men who have multiple sex partners. Other than that, transmission may also occur through the reuse of needles and syringes, and it can also be transmitted through medical surgery, dental surgery, and many more. Now let's discuss about diagnosis. For hepatitis B virus, blood tests can be done. If there is a positive result, it will indicate that the patient has the infections. Other than that, liver biopsy may also be done to find out the patients whether they have liver damage or not. What are the prevention? First thing first, you must practice a very good hygiene. You must have a safe sex by using latex condom. Do not share personal items. Do not share needles and proper dispose of bloodstained items. And lastly, by getting vaccine. In conclusion, an estimated 257 million that are affected with hepatitis B, especially in the African region that contribute the most 6.2 and 6 respectively of adult population. Vaccination is one of the best prevention methods of hepatitis B and highly effective. So to increase the awareness, we can hold the programs to educate people about HPV, about what are the ways to prevent it and what is the importance of vaccinations, and to also include knowledge on emerging disease into education systems or to raise awareness among the society. Other than that, we can also use HPV programs into existing health programs which are more well known, such as HIV, which is in the process limiting its cause and raising awareness. Other than that, make screening tests for HPV that is accessible for all type of classes. Then we can also develop publicly funded screening and treatment programs and providing universal access and increase funding on HPV control in prevalent countries to limit the spread of the disease. Lastly, to adopt new ways to scale up the screening, treatment, and care services that they provide. So this is the end of our video. Thank you so much. Bye-bye.
Created using Powtoon.